So, here's something that's been on my mind this week. A friend told me that she was put on blood pressure medications after a reading of 135/85 at the doctor's office. She said she knows that she gained some weight. She had a surgery that limited her normal movement during her recovery and also led to snacking more and moving less than usual. She knows that she will lower her blood pressure by losing that extra weight she gained and also resuming her normal activity. But she also told me that she just refilled her blood pressure medications. We went over the correct way to measure blood pressure, which she doesn't do. I also told her that 135/85 isn't really high blood pressure. If you ask the American Heart Association, it of course is. They claim that anything over 120/80 is too high, and in that case, her numbers are high. But her reading was considered normal just before the numbers were lowered. It is probably a coincidence that the American Heart Association gets a lot of donations from pharmaceutical and biotech companies. And the lower official numbers probably also have nothing to do with many doctors prescribing more and more blood pressure medications. But the American Academy of Family Physicians sustains that most patients should pursue a blood pressure of 140/90 or lower. According to that Academy of Family Physicians, lower blood pressure numbers like 135/85 may offer added benefits for heart disease prevention, but also increase the risk of side effects like hypotension or fainting. The number of 135/85 is my friend's starting point, and she was medicated for that reading. I am not a doctor, but I think my friend should do her homework. She does have a blood pressure cuff, but she seldom uses it. She would probably do well taking her blood pressure and writing down the numbers over a few days, averaging the result and comparing that to the result shown in the doctor's office. It's a known fact that white coat hypertension exists. A visit to the doctor can elevate any patient's blood pressure more than usual. The doctor is basing his treatment on the 10 minutes he sees a patient in his office and prescribes as he is told to limit the risk. I'm a little surprised and concerned at what looks like an outsourcing of our own health. As my friend doesn't seem to want to really improve her numbers, doesn't want to track them, and seems even proud to refill her prescription. At this age, blood pressure is just what happens. I guess I have to live with it. Really? In light of potential side effects and the very obvious solution, my friend has never in her life had high blood pressure and knows that this increase is due to the weight gained and more sedentary than usual lifestyle after surgery. I wonder why she doesn't seem to want to get off the medication as soon as possible. Another friend was discouraged by her healthcare provider and told not to track her own blood pressure, as the tracking will only make you more anxious. I am a patient too, and I wonder, where is personal responsibility in all this? Your health is your health. Should you not learn and get informed about it? Work together with your doctor to improve any challenges that show up, like high blood pressure, and work together to normalize values that seem too high? We have grown accustomed to simply letting the doctor worry about our health, and the doctor, usually quite limited in the time he can dedicate to each patient, will prescribe something to mitigate any possible risk and give the patient something other than lose 10 pounds and come back. A doctor would probably be afraid to offend a patient, but sometimes hearing the truth is what we need. I am not a doctor, but I can cite one. Dr. Ken Berry recommends patients to make sure to take their blood pressure in the correct way. I will link his video below in the description. Make sure to check it out about the correct way how you should take your blood pressure. In short, many doctors don't use the correct methods. The same methods that were, by the way, used to establish the blood pressure values considered as normal in the first place. Occasionally, high blood pressure may be due to stress or other factors like lack of sleep, and will likely not warrant medication. But they are prescribed readily, and apparently patients willingly agree to take them, even though it may not be necessary. You should take your blood pressure when not stressed, worried, or after a workout, or after running to the doctor's office because you're late, and after relaxing for at least 10 minutes. You should also have an empty bladder. Your legs should not be dangling from the examination table. I don't think they ever took my blood pressure without my legs dangling. Also, you should not cross your legs. Having coffee before your doctor's visit will also increase your blood pressure temporarily. If the doctor's office is cold, that will raise your blood pressure because your body tries to keep you warm. Taking the blood pressure while you are talking will also raise it. If the cuff is too small, you will also add to your numbers. One doctor's office checked my blood pressure right through my sweater. As they had also told me to get on the scale with my winter coat and my purse, I simply left the office after that blood pressure blunder. Checking through clothing will obviously also give a wrong reading. You should self-check for 7 to 14 days. Take the readings as indicated every 12 hours and write that down. Average your readings and compare that to what the doctor measured in the office. Your doctor will be happy to see that you show interest in your own health and will be glad to work with you to improve your health and help you get off any medications that you don't really need, as you are now taking good care of your own well-being. If your doctor isn't open to that conversation, maybe it's time to find one that is. Because your health is your responsibility, and you deserve a partner, not just a prescription. Thanks for watching. Let's keep learning, questioning, and taking ownership of our health together. I see you next time.